Hi, welcome to my channel Health Alice. And today I'll be once again presenting one more exciting, informative, and highly relevant topic, that is liver and cirrhosis of the liver. Now, cirrhosis is a form of the severe liver disease and happens because of multiple causes. It causes scarring that slowly replaces healthy tissues. Eventually, this blocks blood flow and makes it harder for your liver to do its job. It won't be able to filter toxins and help break down nutrients and medications. In fact, liver is the organ where all our foods or drugs gets metabolized, broken down, and the organ won't make proteins and other substances fast enough to meet your body's needs. Over the long term, it can shut down your liver. Now, cirrhosis of the liver, the symptoms. You may not notice any problem or symptoms at the first sight. As your cirrhosis gets worse, you might start to feel more tired and less hungry. Your skin may start to itch, looks more yellow, and bruise more easily. Your pee may darken, and your belly and legs might swell from extra fluid. This is the picture of how a normal liver looks and how a liver with cirrhosis looks like. Some people get nauseated and foggy brained and start to forget things when cirrhosis has set in. Now, the causes for cirrhosis of the liver. Drinking too much, drinking alcohol too much can make your liver swell and hold on to more fat. This could lead to cirrhosis. It typically happens if you drink more than you should every day, sometimes for years. The amount of alcohol that causes liver damage differs for each person. So you should be aware that because your heavy drinking friend didn't get cirrhosis, it doesn't mean you won't get it either. The causes for cirrhosis of liver. Now there is one more form of the fatty liver disease or cirrhosis, that is called non-alcoholic fatty liver disease. Now that is NAFLD. Here are something other than alcohol that causes fat buildup in your liver. The exact reason is not clear, but you are more likely to get it if you are overweight or have diabetes, high cholesterol, or high blood pressure. Now, when it starts to damage your liver, it's called non-alcoholic steatohepatitis or NASH in the short form. You may notice in such cases symptoms like weight loss, tiredness, weakness, spider veins, or itchy skin. Now, one more cause can be hepatitis C, which is a very well-known viral infection. If you have this disease for 6 months or more, it's called chronic and can lead to cirrhosis. The hepatitis C virus is the most common cause of chronic hepatitis, though there are others like autoimmune disease, which I have explained in my previous presentation related to other topics. Autoimmune disease is when your body part gets allergic to your own body part and starts killing your own body parts or cell. That is autoimmune disease. Now, certain medications can also be a cause for cirrhosis, bacteria, or other viruses. Hepatitis C often spreads when users of illicit drugs share needles, that is, needle sharing during drug abuse. You can also get it after having unprotected sex with someone who is infected. Now, other cause can be bile duct problems. Small tubes called ducts normally carry bile, a liquid that helps digestion from your liver to your gallbladder. A number of conditions can narrow or block these tubes, which causes a backup of fluid that can inflame and damage your liver. How you treat it depends on the cause, but your doctor can usually clear your ducts with medication or minor procedures. Even medication can be a cause for causing cirrhosis of the liver. Drugs like methotrexate for arthritis and isoniazid used for tuberculosis can hurt your liver and lead to cirrhosis. Certain antibiotics and statins used for treating high cholesterol and acetaminophen, that is paracetamol, may also be hard sorry on your liver. Your genes, health, diet, and other medicines you take may take a difference too. Tell your doctor about all your medications and let them know if new drugs seem to make you tired, nauseated, itchy, or otherwise unwell. This can be again a symptom of setting in cirrhosis of the liver because of the new medication. Now, certain supplements also is a cause for causing cirrhosis of the liver, mainly herbal supplements, which can gum up tiny blood vessels in your liver either over time or all at once if you take a lot. Over time, this damage could lead to cirrhosis. Clots, genetics, and more. Any condition that scars the liver can cause cirrhosis. Clot can block the flow of blood to the organ or inside it. Your immune system could mistakenly attack and inflame it. Your genes could make it harder for your liver to break down certain nutrients like iron or copper. Or you might inherit conditions that add fat or scarring for no apparent reason. Other conditions which may lead to cirrhosis include autoimmune hepatitis, hemochromatosis, hepatitis B, and heart failure. Now, the diagnosis part of it, your doctor will do a physical examination before proceeding for cirrhosis. Tell them about your symptoms and if you have any history of drinking too much alcohol. Blood tests that check how well your liver is working, along with an ultrasound, X-ray, or MRI, can help confirm that you have cirrhosis. In some cases, your doctor might remove a small piece of your liver to look at under a microscope, a procedure which is well known as biopsy. Treatment part of it. Unfortunately, there is no cure for the scarring already happened on your liver. The liver part which has already got damaged or which is already scarred can not be retrieved or recovered. But your doctor can sometimes stop or slow it down by treating the conditions that causes your cirrhosis. If you have alcohol addiction, find out about the therapy to help you quit. Weight loss can help for a fatty liver patient. Drugs can treat infections, bile duct problems, or autoimmune disorders. Work with your doctor in close coordination to figure out what's causing your cirrhosis and how best to treat it. This much for today on this topic, cirrhosis of the liver. Before I sign off, I always end up with a laughter dose. Now, today's laughter dose is that is the age of artificial intelligence. Thanks for watching. Please subscribe if you have not subscribed yet to my channel and like, comment, share. Thank you.